Ever found yourself pondering the question, what on earth is a deviated septum? Well, you're not alone. It's a term that's thrown around quite often, but do we really understand what it means? A deviated septum might sound like a complex medical condition, but it's something that affects a surprising number of people. So today we're going to dive into the fascinating world of deviated septums, their causes and health implications. Join us as we unravel the mystery of the deviated septum. A deviated septum may sound like a complex medical term, but it's actually quite straightforward. Let's break it down. Your nose, as you probably know, is divided into two passages by a thin wall. This thin wall is known as the septum. In a perfect world, this septum would run down the center of your nose, creating two equal passages for air to flow in and out. But as we all know, perfection is rare. Now let's imagine that this wall, instead of standing tall and straight, leans to one side. This is what we call a deviated septum. It's like having a crooked wall in your house. It's still a wall doing its job, but it's not quite aligned as it should be. Think about it this way. If you've ever walked down a narrow hallway with a big backpack, you know how important it is to have enough space to move. Your nostrils are like that hallway, and the air you breathe is like that big backpack. When the septum deviates or leans to one side, it can make one of those hallways or nostrils narrower than the other. This doesn't mean you have a deviated septum if you've ever noticed that one nostril seems a bit smaller than the other. It's normal for nostrils to be slightly different sizes. When we talk about a deviated septum, we're referring to a significant displacement that can affect your breathing. Deviated septums can range from mild, where you might not even notice, to severe, where it can significantly impact the airflow through your nose. It's not always a problem, but when it is, it can cause issues like nosebleeds, snoring, and even difficulty sleeping. So, a deviated septum is essentially a leaning wall in your nose. It's a common condition and one that's worth understanding, especially if you've ever had trouble breathing, have had frequent nosebleeds, or if you snore loudly. In the next segment, we'll talk about what causes a deviated septum, so stick around. Now that we know what a deviated septum is, you may be wondering, what causes it? Well, let's delve into that, shall we? The causes of a deviated septum can be broadly categorized into two: congenital issues and injuries to the nose. Let's tackle each one in detail. Firstly, congenital issues. This is just a fancy way of saying you were born with it. Yes, you heard it right. Some of us are born with a deviated septum. It's not something we did or something that happened to us. It's just the way our nose formed while we were still in the womb. It's like being born with blue eyes or curly hair. It's just part of our unique package. Now, on to the second cause, injuries to the nose. This is more common than you might think. A deviated septum can occur from a blow to the face, a fall, or any other incident that results in a nose injury. It's common in contact sports like football or boxing, but it can also happen from everyday accidents. For instance, you could trip and fall, hitting your nose on the way down, or a toddler might accidentally hit you in the face with a toy. These accidents can cause the thin wall between your nostrils, the septum, to shift from the center of your nose. It's important to note that a deviated septum isn't always immediately noticeable after an injury. Sometimes it can take years for symptoms to develop. So it could be a while before you realize that bump on the nose from your childhood has left you with a deviated septum. In short, a deviated septum isn't something you catch like a cold. It's either part of your genetic makeup, or it's the result of an injury. And remember, it's not always something you can prevent. Sometimes it's just the luck of the draw. So, a deviated septum can either be a birthright or an unfortunate result of a nose injury. Now that we've unpacked the causes, let's move on to the health implications of a deviated septum in our next scene. A deviated septum might seem harmless, but it can have some surprising health implications. Let's start with the most noticeable one: breathing difficulties. If the septum, which is the wall dividing the nasal cavity into two, deviates or shifts to one side, it can obstruct one or both nostrils. This obstruction can make it challenging to breathe, particularly if you're doing something physically strenuous. Imagine running a marathon with one nostril blocked. Sounds tough, right? That's exactly what a deviated septum can make you feel like. Next up is the recurring sinus infections. Your sinuses and nasal passages are interconnected. If there's a blockage in your nose due to a deviated septum, it can cause the mucus to build up in your sinuses. This buildup creates a perfect environment for bacteria to grow, leading to sinus infections. And if you've ever had a sinus infection, you know they're no picnic. They can cause headaches, facial pain, and make you feel downright miserable. A deviated septum can also lead to nosebleeds. You might be wondering how a structural issue in your nose can cause bleeding. Well, when the septum deviates, it can cause one side of your nose to become drier than the other. This dryness can lead to the formation of crusts that can bleed when you blow your nose or even spontaneously. So, if you've been having nosebleeds more often than usual, a deviated septum might be the culprit. Moving into the night, a deviated septum can also lead to sleep problems. This may come as a surprise to some, but when you're asleep, any nasal obstruction can become more noticeable. This is because your body is at rest and your breathing slows down. If you have a deviated septum, it can cause loud snoring and even sleep apnea, a serious condition where breathing repeatedly stops and starts during sleep. This can lead to a poor night's sleep and leave you feeling tired and groggy the next day. Lastly, it's important to remember that a deviated septum can also affect your sense of smell. The obstruction can prevent smells from reaching the smell receptors at the top of your nose. This can dull your sense of smell and in turn your sense of taste, since the two senses are closely linked. In conclusion, a deviated septum is not just an anatomical quirk. It can have significant health implications affecting everything from your breathing to your sleep and even your sense of smell and taste. It's important to consult with a healthcare professional if you're experiencing any symptoms like these. They can provide a proper diagnosis and recommend suitable treatments to help you breathe easier and live healthier. So, a deviated septum can be more than just a structural issue. It can affect your health and quality of life. We've covered a lot today about the deviated septum, a common but often misunderstood condition. Let's take a moment to remind ourselves of the key points we've discussed. A deviated septum is when the thin wall between your nostrils, the nasal septum, is displaced to one side, making one nasal passage smaller than the other. This can occur at birth or as a result of an injury. We've learned that this condition can cause a range of symptoms, including difficulty breathing, snoring, sleep apnea, and recurring sinus infections. We also dove into the causes of a deviated septum. It can be congenital, meaning you're born with it, or it can be caused by an injury to the nose. Common causes of such injuries include sports accidents, car accidents, or any blow to the face. As for the health implications, we've discussed how a deviated septum can have a significant impact on your quality of life. It can lead to chronic sinusitis, which is a persistent inflammation of the sinuses. This can cause discomfort, pain, and even difficulty sleeping. And let's not forget about the snoring, which can affect not only your sleep but also that of those around you. However, it's important to remember that help is available. If you suspect you have a deviated septum, don't hesitate to seek medical attention. Treatment options range from medications to manage symptoms to surgery for more severe cases. The septoplasty, a surgical procedure to straighten the septum, can greatly improve your breathing and overall quality of life. It's our mission here at #Facts for Wellness to provide you with the information you need to take charge of your health. Understanding conditions like a deviated septum is just the beginning. The more you know, the more empowered you are to make informed decisions about your health and wellness. And that's a wrap on our deep dive into the world of deviated septums. Remember, knowledge is power, and taking care of your health is the most powerful thing you can do. Remember to like, comment, and subscribe to our channel for more health-related content. We're always here to help you understand more about your health. Stay tuned for more #Facts for Wellness.